Welcome to the CLSR, and I'm your host, the counselor. And today we're going to be talking about respect for the elders and learning a little bit about older people. I think we're losing a little bit of our morality when it comes to respecting adults. I mean, just the other day I was at a bus stop waiting, and there were a number of youths there, and there was an elderly person sitting there, and I could see the young people were just cracking jokes and disrespecting the older person that was sitting there. And of course, they're elderly and they really couldn't really do anything about it. But I was just listening to the young people, and I had to intervene because I could not take it anymore. The comments that they were saying were disrespectful, disgraceful, degrading. And I grew up, as many of you did, with a level of respect. And that's the one thing that we have to do is we have to respect the old people or the elderly. And we have to acknowledge them and treat them the way we want to be treated. Because, see, in time, many of us will become old people. And I think the more that we understand about older adults, the better off we'll be, because I think there's a lack of respect that's been going on for too long. And it needs to come back, that respect. And we need to stand up and show our disagreements with the way young people are dealing. Now, not all young people are this way. I've got to say, I've got my children, and I'll tell you right now, they have to have respect for the elderly, for older adults. And it's just a given. If you want respect, you give it. However, I was so disappointed with what I heard that when I intervened, I let them know I wasn't playing. I said, take it somewhere else, and you got to show some respect. And if you don't have respect, you don't have nothing. And of course, these young people laughed it off and went on their merry little way. But it just stuck with me. It was something that stayed with me for the remainder of the day. And I just thought that I needed to have a discussion with you on older adults and understanding them and what they go through and just getting a different perspective and not losing this understanding that they are the same as we are. They are us. And if you can sit there and watch that happen in front of you and not say a word, which a lot of people don't say anything, they feel, oh, it's them, not me. Well, it is you. It might have a different face, a different name, but it is you. And you will be that vulnerable person one day. And you want the respect. So you have to make sure it's given. So I want to applaud all my listeners who stand up and respect older adults and realize and appreciate that they are just like us. So when we talk about older adults, we need to understand that older adults have their vulnerabilities, okay? And we need to understand who are these older adults. See, some define older adults as people over 55, and others say older adults are those over 60 or 65. However, no matter where you draw the line, the age group we call older adult includes people from a wide range of ages and backgrounds. Older adults make up one of the fastest growing population groups in North America. Finding ways to improve the quality of life has become a major goal. Reaching this goal must include support for older adults who have mental health, substance use, and gambling trouble. Older adults may look different from younger people, but they want the same thing from life as they did when they were young. Active enjoyment of all the world has to offer. And like young people, older adults can have substance use, mental health, and gambling problems. But in older adults, these problems can be complicated by the physical and social challenges that are more likely to occur at a later age. Finding out why an older adult's behavior has changed may be difficult, but the first step challenging ageism It's not. What is ageism? See, when the behavior of older people changes, many believe it is simply part of getting old and that nothing can be done about it. Such a belief is part of ageism, a form of prejudice against older people. Ageism is believing things about a person based on his or her age, rather than looking at the person as a unique individual. See, stereotypes in the media, our fears about aging, the tendency to shut older people out of the mainstream of society all help sustain ageism. One way to get rid of ageism is by sorting out facts and myths about getting older. And that's what we're going to be talking about, some of the facts and the myths. See, normal aging needs to be understood. As people age, certain changes to the body, mind, and emotions are natural and can be expected, like hair grays, skin wrinkles, hearing and eyesight weakens, physical strength lessens, movement and reaction time slow. Learning new skills and recalling information may take longer, while vocabulary continues to grow and personality stays the same. Stressful life events like death of the family members, like these tend to increase, while the social support of family and friends tends to decrease. It may also take longer for an older adult to recover from these events, and unfortunately, some may never, ever recover. And there are causes that we need to understand. Like certain health problems are more common among older adults. While most people are able to care of their own health as they get older, the older people who need help are more likely to be physically frail or to have other health problems like dementia, osteoporosis, Parkinson's disease, injuries to falls, heart disease, diabetes, arthritis, eyesight problems, hearing loss, high blood pressure, stroke, digestive problems. Like these are problems that they're dealing with. And think about the physical health and emotional and behavioral issues. Although we tend to think of health problems as being physical, they can also affect a person's emotions and behavior. Like being in pain can affect anyone's mood at any age. Hearing loss can lead to misunderstandings and isolation. Parkinson's disease, like dementia and stroke, may make it difficult for people to speak and may cause them to become frustrated if not given enough time to respond. See, when we notice changes in older people's behavior, it's important to think about the effects of changes on their physical condition. And it's normal if they have some changes in their conditions. But what are the signs and symptoms, that are concerning at any age, especially when the changes are sudden? Like, think about it: depression or irritability that lasts longer than 2 weeks, hallucinations, hearing or seeing things that aren't really there, delusions, which are really fixed beliefs that have no bias in reality, and confusion, disorientation or recent memory loss, thoughts of harming self, right? Stumbling and falling, spending more time alone, slurring of words, sleep problems, change in appetite. When these changes are seen in an older person, it's important not to view them as just a part of getting old. Some of the possible causes of problems could be alcohol or other substance use problems, mental health issues such as anxiety, dementia, depression, physical health issues, prescription medication interactions, gambling problems. It's just important to understand that behaviors may have causes that are not part of the natural process of aging. There are challenges identifying problem causes. Often overlapping factors lead to problems in older adults. Multiple factors can make it difficult to figure out the cause of an older person's behavior change, like symptoms of alcohol or prescription drug misuse can sometimes look like the changes brought on by age-related illnesses. Forgetfulness could be a sign of alcohol use, depression or dementia, a medication side effect, or simply a long standing characteristic of a person who now happens to be old. Failure to pay bills on time by a person who is normally careful about such things could be a sign of memory loss, dementia, or a gambling problem. Many people want to help older adults but have some difficulty finding out or figuring out how to help. Offering to help older adults with behavior changes can help. If you notice changes in an older adult's behavior, the kind of help you offer may depend on how well you know the person and the nature of your relationship with them. If the person is a client where you work, you could talk to a supervisor to get encouragement and support, or talk to a family member before discussing your concerns directly with the client. If the person is a friend or relative, you might try raising your concerns with them directly. Ideally, the person should be encouraged to speak to their doctor on their own time. Keeping in mind the need to respect the person's dignity and privacy, you might also discuss your concerns with other relatives and trusted mutual friends and the person's doctor. Social workers, professional counselors, trained clinicians, and home care workers may also be consulted. And it is strongly recommended that you do consult them before you start taking any initiatives. Like communicating with older adults is important. When communicating with older adults, you have to learn to avoid ageist language, right? Such as the elderly, like terms like that, like the aged or the senile. If you need to indicate the age group, use seniors or older persons or older adults. If you think the person may have trouble hearing or seeing you, ask, can you hear me clearly or can you see me clearly? 80% of Canadians over 65 may have problems reading. Many older adults prefer talking about something rather than reading about it. Encourage the person to talk about their life and their experiences. When people feel comfortable doing so, telling their own story can help them to feel much more engaged. Talking about problems and giving information is important. So when talking with an older person who may have a substance use, mental health, or gambling problem, there are certain things you need to keep in mind. Sometimes they're better than others to talk about problems. If the person is distracted, wait for a better time. If you encounter the older person as part of your job, check with the supervisor before giving information about a problem. If you are permitted, ask the person if they would like to receive this information. Give information in a matter of fact way. Like, would you like to know more about how mixing alcohol and medications can cause problems? Or I've heard that people who are depressed often keep it to themselves, which can make them feel even worse. I've also heard that people who also ask their doctor for treatment are often able to overcome depression. So try to deliver it in those matter of fact manners. So if you're dealing with difficult behavior, and remember, you might be dealing with some difficult behavior. Some older adults may act in ways you find surprising, annoying, upsetting, or even frightening. Sometimes the best thing to do is put up with or ignore such behavior. For example, like if the older person you are caring for insists on telling you the same stories over and over and you find it irritating, think about it. Does the person have a memory problem related to dementia? Is he or she lonely? Does telling you the same story over and over give the person pleasure? Sometimes a shift in how you think can reduce your irritation and help you to feel more generous towards the person. And of course, you're going to have to set some boundaries. It, if difficult behaviors do not seem to be caused by dementia or another mental health problem, you should not have to put up with it. In a calm voice, be clear and direct, and you might even say, you may not yell at me. If you keep yelling, I'll leave and come back when you're calmer, right? Or you could say, when you speak to me in a calm and quiet tone of voice, I'll be happy to help with you. But be firm and gentle when you make these statements. We have to learn to appreciate differences. Older adults were young long ago, in a time that in many ways was different from today. As well as being from a different generation, the older adults you encounter may have a race, nationality, language, or religion that differs from yours. Their attitudes about sexuality or sexual orientation may differ from yours. Some differences may make you uncomfortable at first, but once you get to know a person and to understand him or her, you may become more comfortable and discover similarities that outweigh the differences. And we need to understand certain things. Like, I'm going to talk about a couple things in the past that a lot of people might not know. And see, times were different back then. And events have changed through the generations. And see, a lot of the seniors that are out there today have experienced certain things. Like, for example, in 1924, the Canadian government passed the Chinese Immigration Act, which made it almost impossible for Chinese people to enter Canada. And between 1929 and 1939, the Canadian unemployment rate never fell below 12%. More than 45,000 Canadians died fighting in World War II from 1939 to 1941. Canada's population was about 11 million then. And in the 1950s, when like that actress, what was her name, Lucille Ball, star of the television show I Love Lucy, became pregnant, studio censors would not allow the word pregnant to be used on the show. Contraception and homosexuality were illegal in Canada until 1969. So you have to understand with some of these events that took place, you might be dealing with an older person, an older adult, who's going to have a different perspective than you. So you have to be empathetic and understanding. So if you want to get some help, if you are worried that an older adult you know may have a mental health or substance use or gambling problem, it is important to encourage him or her to get help. And there are places that you can go that could offer some assistance, like a family service agency, a community mental health agency, a counselor, therapist, family doctor, community health care center, a religious or spiritual leader, a workplace who has an EAP program, which is an assisted employment assistance program, telephone hotlines, hospital, settlement agency, like for immigrants and refugees. It's important to know that these are resources that you can access, most of you. All right. So when it comes to dealing with older people, we have to get into the mindset that they have had their experiences, which could be much different than ours. And I can guarantee you it was. People say things are the same. They're not. They were different experiences. And if you do a little bit of research on history, you'll understand some of the experiences. So sometimes it may be challenging for them to relate to you. Older adults are going to have a different perspective than yourself. So you might not always agree on each topic. They will perceive things maybe differently than you. However, many of them have the same wants and needs as you do, and they want to live healthy, productive lives. And many older adults are living older. That's one of the biggest population growths going on right now. People are living longer, and we need to respect that. And so when you see someone being very disrespectful, or if you're raising your children to talk out of turn to adult older family members, then you need to check them. You need to talk to them about that. And, don't look the other way. Don't allow it to go on. And when you're in the street, you know they're a vulnerable population that they're having their own challenges. And they don't need any young people getting at them, making them feel less than or cracking jokes. So there has to be some limitations out there. And when it comes to you working with older adults, you need to understand that there are many different things that you can relate to. And you know what? It shows a lot about you if you're working with older adults and putting in some time and care and support, and understand that you will be there one day, and realize that you will face many of the same challenges, and you would want people to treat you accordingly. So do your work. Understand that. So the best thing that you can do is treat others like you would like to be treated, not look the other way or assume that, it's just going to happen for a little. No, we need to take some time to tell the young people that they need to have a level of respect. Now, we don't have to hammer it home, but we do need to make sure that when we're raising our children, that they do understand this and that they do understand that different people of different ages are going to have different experiences that could be their own. It doesn't mean that we need to adopt them. However, we do need to respect them with the understanding that they are going to face their own challenges, whether it's mental health, whether it's gambling, whether it's substance use, whether it's poverty, whatever it is. As they get older, some of the coping strategies might not be up to par. They might need help or assistance dealing with some issues that they have. So, one thing they do need is compassion and understanding. Older adults need many things, but I would say, above all else, they need respect, empathy, and support, not ridicule and disrespect. Okay, so I want you to be like the wise old bird and spread the word because all of us have seniors, older adults in our life, ones that we work with, ones in our community that have many of the same concerns that we do. So we need to stop alienating them and including them rather than excluding them. Whether in private or public, let's show our caring, understanding, and support to the older adults. Thank you.